over to you to do a few introductions before we jump right in.
Fantastic. Thank you, Mitra. As all of you have seen, a subject of intense discussion in the media and in multiple venues has been considerations about return to school. And we are really very, very happy to bring this forum with a state leader to discuss those considerations. Before I introduce him, I'd like to say that Superintendent Burch will have time to present his comments, and then we'll open it up to questions. We're also very, very grateful to have Dr. Catherine Moffat. She is a pediatric infectious disease specialist from WVU Children's. Clay Marsh, who needs no introduction, the COVID czar and Executive Dean and VP of WVU Health Sciences, texted me 2 minutes ago. He was to be here and be on the panel, but he got pulled into a meeting in Morgantown. I don't know what's going on, but it's just that kind of time these days. So we'll get started, and it's really my great pleasure to introduce Superintendent Burch, who was appointed by the West Virginia Board of Education last February 21st. He has served in both teaching and educational leadership positions for more than 25 years and really brings a wealth of experience that really spans from early childhood education to post-secondary administration. An advocate for the well-being, engagement, and lifelong achievement of all West Virginia children in grades pre-K through 12, he really understands the importance of supporting the whole child through practical and systematic approaches. So I will turn the microphone over to Secretary Burch.
Thank you very much, and I appreciate it. And Dr. Moffat, I get that since Clay Marsh is not with us, anybody I need to throw under the bus will now be you. I'm joking, kidding. All right, so I told Dr. Marsh I would try to keep the comments as brief as possible, but also provide some context that sometimes the general public doesn't have, they don't get to hear of what's happening behind closed doors. We all know that, especially me, of all people, when I was appointed February 21st, we had no idea that we'd be walking into something such as this. And the more forums I do with teachers, the more forums I do with district leadership, our unions, health officials, I kind of go back and I take a step back and remind them that prior to this pandemic, this time last year, as a state, we considered ourselves a state of crisis for young children. And I didn't want our educators and district leaders to forget that. This time last year, I was speaking about initiatives that the department has on for one caring adult. If you've heard me speak with, whether it be with the governor or with other groups, I continue to focus on the Department of Education's mantra that we will have to consider who is the one caring adult that's going to step up. It has been the one thing that keeps me up at night since March 13th when we closed our schools. So let me give you a little bit of context. We were working with district leadership prior to the pandemic with their strategic plans. Being a state that in 2018 had, we were pushing 7,000 children in foster care. We were pushing over 50 to 55 mortality drug-related deaths per 100,000. We were a state that 50 out of 1,000 live births were born with neonatal abstinence syndrome. We're the 4th highest poverty rate in the nation. And we now are hitting over 11,000 children that are identified as homeless. And this is all prior to the pandemic. So when March 13th hit, we immediately got the governor to recognize that these children rely on school for much more than the education. We immediately knew that they needed to be fed, and we immediately knew that there had to be one caring adult looking out for them. Unfortunately, I'm sad to report that we did the best we could March through June, but what we found is many of our counties were not prepared for such an emergency. The First Lady, Mrs. Justice, has been in front of a initiative called Communities and Schools, where dollars have been shifted and focused to hire more school nurses, social workers, mental health professionals, to really target the needs of our most at-risk children. And what we found is during those 3 months, those districts were more prepared to have supports in place for the community. We also found that remote learning, even though it was a time of triage, did not work for most children. We found that about half, if not more than half, of our families do not have internet or do not have quality internet to engage with their school. Even in places where there is access, cost has been a great factor. So up until March 13th, I would have been the first to preach from the mountaintops that public education is the great equalizer and should be the great equalizer. I don't know that following March 13th, I can continue to say that any longer. What we found is that we expect the learning to take place and the supports to take place out of the brick and mortar buildings, and we're simply just not a state that was prepared for that. Our numbers of referrals have declined and the lowest we've seen in over 5 to 6 years. I had to explain to a group here recently that that is actually not a good thing. We are tremendously disheartened that we do not have the supports in place to attack this. So with that in mind, we were asked over the last couple of months to put together a reentry advisory council. And that reentry advisory council, you all, not one time debated on whether or not schools should or should not open. That entire advisory council, 42 stakeholders across the state, including the major teacher unions and Service Personnel Association, the governor's staff, the West Virginia Board of Education, agreed that we don't have an option. The school must open. It is the safe haven for these children. The risk of them not being in school greatly outweighs the risk of them being there. However, we knew that the toolkits and ideas that we put together, and you know, I continue with Dr. Marsh and the Department of Health and Human Resources, and maybe many of you on the phone here that have chimed in and weighed into the reentry of how to make it safe, how to make it feasible, not only for the children, but most importantly, our teachers, our service personnel. We have bus operators, cafeteria workers. We had to create a plan that takes them into account. We have right around 5,500 to 6,000 professionals in the state of West Virginia right now working in the school system that are eligible for retirement today. And if they were each to retire, we do not have a workforce right behind them to step in and take their place. So we had to take those things into account. And most importantly, we had to take into account flexibility for families. We have about 36,000 families who have reached out to us through an online survey that we used as we put the toolkits together. Of course, we have several families that are opting to shift to a virtual school model during the reentry. I'm glad that they have the means to do that, but at the same time, I will continue to preach that I'm disheartened that it's not equitable for everybody. So our most at-risk families oftentimes will not have that option. So working with the governor's office, we have prioritized 3 key areas for the return to school. Number 1 is the physical, social, emotional, and mental health well-being of all of our students will be priority number 1. We're asking all teachers and staff to be prepared. We're doing trainings. We're finding as many partners to help us as much as we can. In many cases, many of our children, especially our at-risk and young children, will not have been in a structured environment for up to 5 to 6 months. Without eyes on them, our teachers are going to have to be prepared to deal with, in many cases, the trauma that these children will come back to school with. Secondly, we do have an equity issue that we're attacking. As I told you, we have a major equity issue with access to technology, but we found that through the Communities and Schools process, we also found that we have an equity issue for resources in general. I applaud the First Lady and the effort she's done around Communities and Schools and other initiatives to put money and supports. But what we found is about 22 counties have those initiatives, which means based on your zip code and because of where you live, we actually have a system right now to where resources are available more readily than others. And it's not acceptable. And third, our priority will continue to be on the achievement gap. We know that there'll be We know that there will be a much wider loss of learning, an achievement gap that we've not seen in the past. I've actually reached out to colleagues that have been through natural disasters, whether it be hurricanes or, for those that don't know me, I actually spent the first several years of my teaching career in Kuwait City after the Gulf War, dealing with trauma and trying to establish some type of normalcy for the children of Kuwait. And what we found there was it took several years to recoup some of that trauma. And I know that's hard to compare traumas across the nation, across the world, but at the same time, I do think we have quite a population that doesn't realize the trauma that our young people were actually in. We understand the families reaching out to me and worried about whether school's 5 days, or worried about what transportation looks like, or what eating in the cafeteria or a day in the school looks like, are probably not the families that we're most concerned about, the ones that we're not hearing from. So the toolkit is now live. I know it's causing some debate. Again, I can't thank Dr. Marsh and the folks at DHHR and health professionals around the state that continue to help us with this. Right now, we had a leadership meeting, for example, this morning, and I opened up that right now we're all being kind of led by, and that's okay. I understand that. Whether you're a teacher, a bus operator, a cafeteria worker, or a parent, we tend to still be in a very emotional state about the start of school. And what we've asked Dr. Marsh to do is assist us as best he can in making sure that we do follow the science, making sure we make it as safe as possible, making sure that our children are in an environment that learning can take place and be safe for the adults. But we also know that at any given time, if the communities do not step up and do their part, that there may not be school. So starting next week, we actually will have a group that will be working on metrics for schools opening. Been very clear with Governor Justice that on September 8th, that's simply a target date to open schools. We understand that there may be some counties, if they cannot get their numbers under control, that may not open up live on September 8th. And so we'll be working with him and a group of health professionals on what that looks like. And I know that's a lot of information, and I tend to go off probably topic a little bit, Sally, on some of my worries about our most at-risk children, but I will tell you sincerely, since March 13th, I have been worried sick about the children that we've not heard from, that we've not had contact in. And I just want to remind everybody that we were a state of crisis prior to this, and that has not changed. It's actually, we've doubled down on our efforts that we're going to have to make.
Thank you very much. And I think your comments were heartfelt and right on. Before we open up to questions, I just would like to invite Dr. Moffitt, if she would like to add any comments.
So I believe Dr. Moffitt's audio is still connecting and having some issues. So Dr. Moffitt, if you can hear us, would you like to chat in and let us know?
And perhaps while we're getting that connection, Dr. Costello works in pediatrics as well and has worked with DHHR. Lisa, would you like to make some comments?
Sure. Thanks so much, Dr. Hodder. And thanks to Superintendent Burch, who has been very willing. The West Virginia AAP has chimed in, and he's been engaged with DHHR and the Bureau for Public Health. And I think, children, as Superintendent Burch says, get so much more from being in school than just in education, the social, the food, the mental health benefits of being in school. And the American Academy of Pediatrics has weighed in and advocating that the goal should be what we've done in West Virginia to have children in school. And I think as healthcare professionals across the state, we need to be educated on the importance of schools and how to be talking to families, because I think they're going to be turning to their healthcare professionals and asking for our opinions as to whether or not they should send their children back to school. And I think most of the concerns that I've heard from are from teachers or individuals that are worried that children may bring, illness home to to their families. And so I think as healthcare professionals, we have to be educated on this. So appreciate Dr. Hodder and the ECHO team, again, picking a timely topic that healthcare professionals can be educated about. And I would refer to multiple individuals. The AAP has put out similar guidance regarding back to school entry. And I think our state has adopted many, if not most of their recommendations. So really appreciate the work that the Department of Ed has put in to ensure that children get what they need from education to other social support services, while balancing and making sure that they can be safe in that process as well. So I think healthcare professionals are going to be getting a lot of questions about this as back to school physicals happen. And I know that I personally, and if Dr. Moffat can get connected, I'm sure she's also been getting a ton of questions about, what should I do with my child? Should I send my child back to school? What's the risk for my family? So I definitely think that this is going to be an ongoing question that healthcare professionals get. And I think having an understanding of what our schools are doing to put in place to make it as safe as possible is going to be helpful in guiding that education. Because I too share the concern, we have decrease in our child abuse reporting rates across the country and in West Virginia. And that's worrisome because, healthcare, we play a role in reporting, but so do our education partners in reporting neglect and abuse. And so there's a lot of ramifications of not being in school that we have to, weigh as well when we're navigating through this pandemic. So thanks, Dr. Hodder, for, again, leading an important discussion on this. And, we look forward to ongoing work together as a community to do what's best for children in West Virginia.
And is Dr. Moffat, is your audio
Yeah.
working? Oh, good. Okay.
Can you hear me? Yeah, it's working. So I think this is really challenging. There are places in other parts of the world where clearly schools are back in session and it's working. The thing about those areas is the infection in the community is under control. And we can debate, but at least in Morgantown right now, Mon County, we are in a surge and we're a hot spot. So I think that there are many, many questions that are really unknown. So we clearly know this, children do get COVID-19 and they're susceptible to getting it just like any of us are. The thing that we have seen is that children don't get that sick and they certainly are not being admitted. I think 22% of the US population are children and 0.2% of the reported hospitalizations so far have been pediatric patients. Now, you can look at it one way and say, well, is that because in mid-March, all the children went indoors and went home and they haven't really had a chance to really get COVID-19? Or is it because they get it milder? And I think it's a mix of that. And I think it is clear that children don't get as sick, but they do get COVID-19. How much do they transmit? This is again the thing. If they're getting a lot of the asymptomatic infection, they probably are not as contagious as somebody who's pre-symptomatic or then is sick. So I think that we have a sense of that, but I think that's still emerging. And at what point, how much are we willing to tolerate of infection in a community, and I guess this is how I'm viewing COVID. We've got to learn how to live with this here. We've navigated so far 6 months, 5 months, however many months it's been. It seems like 10 years, but anyway, I don't even remember anything before COVID. It almost seems that way. I'm making a joke, but so how we've navigated, but we've had a lot of people at home. There still are a lot of people at home, and that's okay. But we've got to figure out how we can have society and our schools and kids go back to a normal education while it's in this time of COVID. And I think that's what we're figuring out. So I don't think that we can say that children don't get it. But I think we probably can say they don't get as sick and they're not as likely to be transmitters, we think.
Thank
So,
you.
I'll
Thank
take
you.
questions, whatever. Thanks.
Superintendent Burch, would you like to respond before we have Mitra open it up to audience questions?
Absolutely. So Dr. Moffitt kind of hit the nail on the head there that we're being very, very clear with the governor. I just want to reiterate that, we've targeted this September 8th date as, having these plans to return to school, but trying to also be very, very clear with the public that there's going to be locations that if they're not learning to deal with this and we're not seeing the numbers decrease, we also don't want to send a false message that this is something, no matter what, we're all going to go back to school on September 8th. I think there's going to be places in the state that we're going to have to look very closely and clearly of whether or not they should open or open up differently. But I also understand that if you live in Wyoming or McDowell County and the cases are very, very low, that maybe they're a little closer to some normalcy. And I know that our teachers and some of our district leaders and union leaders would like to see one approach to tackling this throughout the state, but I also don't believe that's a fair and appropriate way to deal with it also with 265,000 children. And then secondly, real quick, Dr. Costello, I was looking through the names very, very quickly, and my colleague here taking notes for me asked me to remember to thank you personally for some of the work you did helping Clay Marsh and others in DHHR with our current toolkit.
Thank you very much, and a hearty thank you both to Lisa and Kathy. I think I'll turn it over to Mitra, who is much better at moderating questions than I am. But I would ask each of our panelists, and that includes Lisa as well, to really feel free to chime in. So Mitra?
Thank you, Dr. Hodder. And thank you, Dr. Costello, for putting those resources into the chat. So definitely take a look at that, everyone. So the first question we got was, what role do you see school-based health centers fulfilling in reopening of schools?
Make sure I click mute, unmute. So many of our schools have invested in school-based health centers. We're asking the district leaders to utilize those school-based health centers as they put together their plans. I probably should have said this earlier. Every district will have to submit their plans that include every item in the toolkit for reentry. So we're asking them to work with their local health professionals, the school-based health professionals, but I'll be honest with you, many, it's not a shock to anybody. We have such a shortage of school nurses. Our school nurses were completely overwhelmed as we saw during March, April, and May, trying to close out school. Our school nurses, we have a brand new school nurse coordinator that begins on Monday. Her name is Carol Ward. I think she's from the Clarksburg area. I actually think on the weekend she still does work with Ruby Memorial. She is she's got her work cut out for her. The school nurses have been very vocal in how they want to help, and we are asking them to please collaborate with these school-based health centers. The First Lady has been very vocal in our communities and schools efforts to make sure that we have a lot of supports in the schools, not only for families around health, but in many of these areas too, we have others. We have counselors, we have social workers, we have a variety of resources that the families just are in dire need to receive.
Thank you. Dr. Moffitt or Dr. Costello, any comments further on that or thoughts?
So the Primary Care Association, which is the association that represents the school-based health centers, were one of the organizations that the Department of Ed engaged in creating their guidance. And Sherry Farrell and members of the Primary Care Association, I think there's some on the Echo today, have been very engaged and great partners with the Department of Health and Human Resources when it comes to testing, to contact tracing, to working with their communities. And I think school-based health centers are going to be a vital part of that, whether it's delivering immunizations, which we know are still essential services, and making sure children stay up to date. But I think the Primary Care Association has been very engaged to ensure that school-based health centers are going to be part of the overall strategy when addressing COVID, coming from testing to contact tracing and making sure that preventative health care is also maintained. So they have been at the table, and I think that they will be an ongoing key partner. West Virginia has, I believe, the most school-based health centers per capita in the nation. So the Primary Care Association and those FQHCs and school-based health centers have been key partners in the entire pandemic response.
And Dr. Moffat, I'll ask you if you have anything to add, and then I see Jennifer Boyd, who I know works with the Primary Care Association, and perhaps then she could comment. Dr. Moffat?
Yeah, I think I think they play a key part in maintaining the well child care of kids and all the other needs that kids have, in addition to hopefully helping to recognize if there is COVID-19 in the school and helping with that. And certainly as an infectious disease person, I'm very willing to help in that aspect of answering questions and figuring out. I think though that I wish all our schools had same services. So I think they're very, very important.
Jennifer Boyd, do you have any comments relevant to the PCA's efforts?
Well, my partner Emma White is on the call from the PCA too. I'm not as up on the PCA's efforts, but I was just informed of what Dr. Costello had spoken about, and I'm really glad to hear that the PCA is working with the team, because as a school-based health provider, a physician assistant, I've been thinking about the role that school-based health centers can play in the big picture of reopening. Everything that Dr. Costello mentioned, whether it's just the ongoing care that we have already been doing, or including vaccination, or screening and testing and triage and that kind of thing. So I'm just very happy to hear. And Emma White may be more aware, but it's just really, I think, a vital collaboration. That we really are lucky to have the infrastructure in place for that.
Emma, would you like to comment?
Sure. Actually, John Kennedy is on this call. He is the West Virginia Primary Care Association School-Based Health Coordinator. So, hi, John. I see you now.
Hello, everybody. So the PCA was a part of the process to engage the plan for schools, and we are grateful to be a partner of that, not only in the physical health, but in the emotion, or the wellness, the emotional and mental health too, because 70% of all school-based health centers provide behavioral health services too. So as we re-enter into the schools, there's that physical component, but there's also that mental health component, which is going to be vital as our superintendent has shared. The struggles are not going to be initially the academic piece. It's going to be, how do we get these kids to some place emotionally and physically that they can actually then begin to learn.
Thank you. Mitra, do we have more questions?
Yep, we certainly do. Okay, so our next question is, our teachers are also in the high-risk group. What are the plans if there is an outbreak that removes teachers because of the illness?
Superintendent?
Yeah, that was, we've gotten a lot of questions. I've tried to make myself available to the teacher groups. In fact, I did a town hall with WVA yesterday, and that was actually a question that teachers asked me. And honestly, it's a very, very important question. As I said, having nearly 6,000 educational professionals that could retire this year being in a vulnerable state, and not only if they fall category, but also other health impairments, we're working with our districts because we want to be flexible with them. There are other ways that teachers can engage students. In 48 hours, in one particular county in the southern West Virginia, they opened up the registration for virtual school. Over 800 students in 48 hours registered for virtual school in grades 6 through 12. Problem that runs into is now, when they start looking at the return to school, the footprint has gotten much smaller at the actual building in grades 6 through 12. But when the footprint reduces, we're going to have teachers that won't have classes. So we're actually looking at some possibilities of how some of our teachers can either be trained or rethink how they can contribute in a virtual manner and support students. We also know that we have counties looking at additional supports, shifting focus from, I'm glad to hear Mr. Kennedy say, on the social, emotional, and mental health. We have districts looking for teachers who may be willing to shift over and temporarily during the start of school offer their expertise to be part of that support system. But probably Dr. Moffitt or Dr. Costello might speak more to the actual outbreaks in the school. I know Dr. Costello helped with DHHR and Dr. Marsh about the potential outbreaks. And our toolkit includes that we do know there will be suspected cases or even confirmed cases. And there will have to be protocols in place for not only the teacher and the staff and the children, but Dr. Costello, I don't know if you want to elaborate any more on protocols for that.
Sure, Superintendent Burch. I think that it's a great question, and as we've discussed, and I've had discussions with Dr. Moffitt and her ID group at WU as well about this. I think it goes back to what Dr. Moffitt highlighted and what is really the community spread. I mean, if we look at, again, COVID is not flu. I'm not going to make them equal, but you know, if we see flu outbreak in schools, we have at times shut schools down because there's a lot of transmission of schools. And part of public health investigation is looking at, you know, who was exposed. Dr. Moffitt could speak to, you know, we have seen outbreaks in daycares. So we've talked about, you know, identifying who was in close exposure and who would be at high risk that need to get tested and need to quarantine, or if they are positive, who would need to be isolated. And so the local health department will work very closely with schools, but then also engaging healthcare personnel to make that risk assessment as we would do and have already been doing in other settings in which there are children and adults. And Dr. Moffitt has been super engaged, as she always is, a great advocate for children in daycare. So I don't know if you want to talk about that, Dr. Moffitt, because I think that's a good analogy to what the question is, because we have had daycares go back to school and we have seen outbreaks in daycares, and the protocol will, I think, model that, and that's how we've designed it as we have looked at other outbreak situations. So Dr. Moffitt, I don't know if you want to talk about your daycare experience.
So surprisingly, there haven't been huge numbers in the daycare, but there have been cases in the daycares. And I think, you know, you can look in the literature and you can see that, I think it was in Canada, had a classroom where elementary school had a large number of kids who tested positive. That's the outlier. That's not daycare, that's elementary school. But most of it is that we're not, there, other places are not seeing huge numbers in kids. But getting back to daycare, you know, the teachers mask, and the teachers are masking at all times when they're around the kids, and they're not eating around the kids. They're not taking their masks off. And so of the teachers that I'm aware who have had COVID, there's not been transmission there. So the children who have gotten COVID, who've been in daycare, I believe, you know, somebody could prove me wrong, but I think, you know, it's felt that the children got their COVID in the community, not attending daycare. Now, you know, I applaud the daycare. So what happens is you come to the front and you're screened, whether temperature. Now we could debate about temperature because only 40% of people with COVID get a fever. So will that clog up the system taking everyone's temperature? But anyway, the way the daycares, they take a history, coughing, congestion, fever, any of these things, and they're not allowed in if they have that, or the family member. And then the parent does not accompany the kid back, and the kid goes to their room and is only with their room. And then I believe that there are smaller pod units, not, it may not be feasible in public school to only have, like, say, 10 children in a classroom. I'm just saying, it may not be feasible. But I think masking is really a key. And we're all who are not wearing masks are in our own offices or in our own home. And I'm in my own office and the door is shut. No one else is in here. But all the rest of the time I have my mask on. And you probably saw I was eating my lunch in here. I don't eat my lunch I don't eat over in the clinic anymore. I don't eat in other places. So I know the kids are going to have lunch at school, but is it the best thing to have them all eating in the same place? I think, I don't know. I don't know the answer to that. But if you took eating aside, if you can have everyone masked and then a few times in a day you're all washing your hands, you're leaving your mask alone, I think it can be successful. I know we have children, and we have children who have special needs, and there's behavior things. I think one of them maybe, Mr. Kennedy said, just getting the kids back in the classroom, maybe the first week is going to be practicing wearing your mask. Maybe you give them masks to decorate, or I don't know what you do in order to engage children in wearing their masks. I think the teenagers are a whole nother group. They don't see, well, they're whatever. I'm not going to analyze adolescents. But if you can engage adolescents to get them to understand what they need to do, then I think it will work. If they don't think it's important, they're not going to do that. But I think that's going to be one of the real keys. And I'll just say this: the AAP and WVU say masking over the age of 2. And I don't know, I wasn't in on the decision of 9 and above for our state, but I think that we really have to look at children and masking. Now, okay, I've taken a break from my mask, but otherwise I have my mask on all day. And if you know me at all, you know that I'm a rule follower and I don't mess with my mask. I'm not pulling it down and shifting it around, taking it or whatever. I leave my mask alone. Now, I know people adjust them, whatever, but if we really can follow that of keeping a mask on, and you have pumps of hand sanitizer, I think we'll be okay. The challenge is going to be, actually, if you look at the Dominion Post this morning, they have a great cartoon where they have kids and they're using them as slingshots and putting them as masks and doing whatever. We can all imagine. Kids are kids. So how do we help them? Because I think we don't have a vaccine, we don't have a treatment. What do we have? We have physical distancing. We want them to be social, but it's physically distancing, and we have masks. And maybe it's as simple as that. And yet it will be a challenge. Now, in the daycare, the kids are not wearing masks. That seems to work well. Maybe with the younger kids, I don't really know data, but maybe, and is it maybe age 9 then, when then they have to wear a mask? I have to say, I don't have all the answers on that. But I think it will be hard when you have a 6-year-old who doesn't have to wear a mask and a 9-year-old in the same family, or they're on the bus. That's a pretty crowded. I think they all have to wear a mask to get on that bus. I don't know. Anyway, so those are my thoughts on that.
Thank you. Would you like to comment further?
Well, I will tell you, Dr. Moffitt will now go on the list with Dr. Marsh that scares the crap out of me. I'm joking, Dr. Moffitt. She's actually hit a couple points that have been some of the biggest items of contention when we put the school toolkit on. I'll be honest, and folks that know me know I'm very, very transparent. I also was not in the conversation of why 9. and not 5 or not 6. We try to stay in line as best we can when those are made, but I will tell you that does not mean that we ignored those younger learners. One of the things we're encouraging the districts to do is similar to what she mentioned for the child care centers. We're looking for our young learners because they sometimes aren't going to be able to be as independent as those middle school and high school students with masks and remembering all the rules. We're asking the schools to keep the children in core groups. School will look very, very different. We're asking when they get to school, they stay in their classroom. They're not changing classes any longer for art, PE. We're not all going out together on the playground at the same time. And cafeteria has been one of the biggest issues that the districts have pushed back on. Where do they eat? Do they eat and stay together? Do we rotate schedules into the cafeteria and go to a very, very small eating in pods? So we tried to meet both of those, but I'll be really honest with you, the transportation probably got the most attention. So we will be putting out videos working with transportation operators. In fact, something I am not used to is spending half a day on a video shoot, but we're going to put videos together preparing children of what's going to be different. Best practices for getting on and off the bus, what to touch. And to be honest with you, we're hoping that our teachers take advantage of this time to just continually start focusing on a new culture of just healthy practices. It is okay for us as a society, mask, hand washing, remembering not to be close and that physical distancing. But just to put it in perspective, if I were to tell you all how many threats I personally have had, even willing to come down to the Department of Education into my office of how dare I have any child or anybody wearing a mask, it's going to be interesting how some of these areas react to these new protocols that will be in place.
And if I could just chime in, I think Christy Day, who's the Director of Communications for the Department of Ed, the Department of Ed did a great job. I mean, you can tell their teachers and their educators, because in the toolkit that I shared in the chat, and I'm sure Mitra will share in the email, at the very end, there are really great graphics that I think would be great. I know as a pediatrician, I think pediatrician offices hanging those up for consistency. They're child friendly, that kind of go over the recommendations, and I think they're very helpful and child friendly and express the guidelines, and they're a great resource for use. I think the schools are going to have them up there like a screening question, but even just the symptom checker and the community mitigation strategies are really child friendly. So if you take care of children, I would direct you to that as something to put up in your offices or have at the ready to disseminate to your parents, because I thought they were very nicely done to explain it at a level that a child could understand about the importance of these, why we're doing this hand washing and wearing a mask. I'm around other people, that's why I'm still wearing my mask, but I think that those are great resources to have at your disposal.
Thank you. Mitra, more questions?
Yes, we certainly have a lot of questions coming. Excellent. So the next question is, recently there was discussion to withhold funding from schools if they don't open in the fall. What would happen if we have to go back to an online teaching model?
No, please. There's no discussions. The counties will have to be prepared to open up September 8th, either live, blended, or one thing that's been part of a discussion is people have asked, do the counties have to offer a virtual option? They've actually had to offer that option since 2017. It is actually required that every district have an option for families in grades 6 through 12 to have a virtual platform. So there must be that option. The funding's interesting. There's about $78 million that typically doesn't get reported by the governor in his weekly updates, but that has been directly provided to the schools in preparation for the return. I have actually asked the Department of Education to, for lack of a better word, empty its coffers. I've asked them that I don't want a dime sitting here at the Department of Education for any other initiative other than getting back to reentry and focusing on those 3 priorities. So yesterday, as a matter of fact, every county received a grant application. We found, I think we've identified about $18 million that we're going to empty out of the Department of Education. Trust me, it's making our administration a little uneasy to empty that. But those are going to be specific to, number 1, priority given to trauma, the return and focusing on the mental health, social, emotional well-being. Those are going to be number 1. Number 2, priority will be given funding to equity, and that is equity for additional staff, social workers, nurses, as well as technology. And then number 3 will be items around closing or addressing the achievement gap. But to kind of hit the crux of the question, no funding withheld. We expect, we have not heard any word of a county that on its own would choose not to open, but that does not mean they will potentially not open under the directive of the governor.
Thank you. Mitra?
Okay, so will each student have a backup plan for care and supervision if COVID removes their caregivers? Many students are cared by grandparents and family that are also at high risk.
I'll answer briefly, and then Lisa or Dr. Moffitt might want to chime in. But you know, back to what I said earlier, I've been, you know, I understand that we have many that are in kinship care. And also, I'll go back to nearly 10,000 that are identified as homeless, 7,000 in the foster care system. And those are all numbers prior to the pandemic hitting. So the idea that we have these backup or contingency plans for these children, that is one of the things that will be included in the return to school plan. I think that the pandemic is causing these districts to start having a much broader conversation of what they were really prepared for and what they weren't. Back to my earlier statements, I think that it should, what a shame based on your zip code of whether or not you had access to additional school nurses or health services or social services. And it's just what we found was the case. So we are asking for them to have a contingency plan. What if the governor were to close down a district immediately again and go straight to remote learning? Are we better prepared to assist those families?
And I would just add the Bureau for Children and Families, Commissioner Linda Watts has been very engaged in this entire discussion. We've already seen this happen, and as Superintendent Burch mentioned, we have a lot of individuals in foster care, so their caseworkers work very closely with the families to identify if they're still able to provide care or if they need to have alternative care, and multiple DHHR staff members have stepped up to be able to continue to deliver care. It continues to be a concern for the Bureau for Children and Families, but they're working on contingency plans to ensure that children would continue to be able to receive the care they need in the event that their care provider gets ill and leads to be hospitalized or something of that nature. So there are ongoing plans for that. I think there always needs to be more, as we've already said multiple times, this was an issue before COVID. And so, you know, the need for more foster families. And so that is something that certainly has been on the radar of DHHR from the entire beginning. The secretary of DHHR and the deputy secretary ask about this all the time in regards to foster care, kinship care, and what would we do to care for children if their loved one is not able to do so due to COVID.
Thank you. Mitra?
So has there been any consideration given to partnering with broadband providers to provide free or discounted coverage to needy families?
Wow, if you only knew how much time broadband has taken up on my schedule, but I'm not in it alone. What we found is during the pandemic, the Great Divide, as I said, for technology, I mean, this Great Divide is not just an education issue, it's actually a health and economic issue as well. Dr. Sarah Tucker, the Chancellor of the Higher Education Policy Commission, is joining me in this effort. She found, for example, at one college in particular in Central West Virginia, over half of the college students, when they closed the campus, did not have access to internet. And she also found that a large portion of her faculty did not have access to internet. So we've reached out to the Broadband Council and to the governor. I will not accept the answer that it takes 6 to 10 years to get our state plugged in. It's unacceptable to me. So we decided to venture out on our own and see who was out there. So I never thought in a million years that I'd ever be having a conversation with Elon Musk and the folks at SpaceX or the CEO of Sprint or T-Mobile, but I'm willing to go down any path. And I'm actually happy to announce that Sprint and T-Mobile will be working with us, as well as other providers throughout the state. There is for lack of a better word, a loophole that we have found where we can actually use state dollars to put a Wi-Fi device in the home. As long as that home, though, it has to have access to a cell signal. Now, I know for many that will still be very, very difficult. We understand that. But immediately in September, October, to be able to impact between 30 to 50,000 families to put a Wi-Fi device in their home, and for about $10 a month, unlimited data, because it falls under this loophole for education. So we're actually exploring that right now. I've asked for our technology dollars to be held back from the total amount that we're allowing to go out to the districts. We're working with the governor's office now, and I understand that some of the broadband community will call that a Band-Aid. I understand that. I'm willing to take the criticism, but if there is a way that we can immediately connect between 30 and 50,000 families in the next month or two to the internet, it means more than just solving a problem for the education issues. So yes, there's a lot of work being done around that, and I'll cross my fingers that the work we do with the governor and Secretary Gonch in Commerce and Broadband, that it works out.
Thank you.
Thank you. So can someone speak to the academic concerns of our children in the state? Many parents feel that their child will be half a year to 1 year behind when they get through all of this.
Yeah, so 5 to 6 months outside of school. We do have some, I will say. I don't want to paint the picture that every school district during that triage period of March through June, we're in the same boat. I'll give you an example. If you happen to be a student in Ritchie County, Little Ritchie County, they had a very, very well-developed plan to access their families. They're hitting right around an 85 to 90% access rate for internet in Ritchie County. They actually saw their benchmark assessments increase during the pandemic, which is something I'm still a little blown away. I think they all cheated. But no, don't tell Ritchie County I said that. They did not cheat. We actually have told teachers we're going to have to be prepared in September 8th. They're going to see achievement gaps probably unlike anything they've seen before. We all typically as educators prepare for the summer learning loss, especially for our at-risk students. And this is going to be well beyond the typical summer learning loss. So the trainings we're putting together right now, we have several trainings that the districts are getting ready for at the end of July, beginning of August. Part of the training is how to prepare to get a new baseline. How do you assess where students are when they come? I am very, very proud of some of the work the districts are doing, because they're also, besides the academic baseline they're looking at children coming back with, they're looking at and some of that trauma-informed care baseline. So our teachers are going to have to be prepared that they're going to have students that are going to be completely on different spectrums of academic achievement. So they are prepared for that. I know we've had several families, and it tends to be a lot of families of younger children, children whose kindergarten, first grade, second grade years got disrupted. We know those are very formidable years. We know that those are years when they're those essential reading skills, and but we are hopefully we have a professional learning system that will help our teachers prepare for that.
Excellent. Thank you so much. So I know we touched upon this briefly earlier, but I still wanted to ask the question. What will be the masking requirement for children in school in regards to the age requirement?
So, wow. Right now, you know, if there was a way that I could put my hand over Dr. Moffat's screen, I'd put it, you know, over there and block her out right now. But right now, we're staying in line with the governor. It's grades 3. They will be required on buses. They will be required entering and exiting the school. They will be required in all congregate areas. We know that our older students will leave them on throughout the day. Our younger students, we're getting a lot of questions about when they're in their core classrooms, is there an ability to remove them? We're going to have to do some work with our teachers about what that looks like. We have classrooms that are not designed to be much more than 3 to 4 feet apart. However, we have other classrooms that are actually some of our new facilities that are able to go beyond even 6 foot separating children. We're mostly concerned right now, most of the questions I received yesterday on the teacher forum were around preschool and kindergarten. I'm just glad to hear Dr. Moffat talk a little bit about the child care and staying within their core groups. We are putting in some protocols. I know this is going off the question on masks a little bit, but we are putting on in the protocols of I think our pre-K and kindergarten teachers are going to have to seriously consider what the sanitizing and the materials looks like. I think they're also going to have to start looking at those shared materials and whether or not we're going to be able to do that with all. And this is probably better for Dr. Costello or Dr. Moffat. There is currently a debate happening with teachers over face coverings versus face shields and the ability for their students to see their face.
So I think face shields are a great option. You know, here we have the debate because, well, I don't know where mine are, but I have a pair of goggles. So not only when I see patients am I to wear masks, but goggles. So if our goggles fog up or whatever, we could instead wear a face shield. Now in healthcare, we're told we still have to have a mask underneath there, but I think for our risk is maybe a little bit different because anyway, we can debate that. So yeah, so I think that a face shield is a reasonable option so that you can see the face, you can see all the expression on your face, you can see the mouth and understand what they're saying. And I think for certainly hearing impaired and other kids, it's really, really important. So I think that is an option. Now, could kids wear a face shield instead of a mask? You know, I don't see why not. It's the keeping it on and making sure it fits and it's not fiddled with, or, you know, that it doesn't get too tight and dig in the head, or, you know, there's all kinds of things, but there's a lot of options there. So that I think, Lisa, do you want to comment on that?
No, I agree with you. I think the only other thing I would add is the importance of, in addition to mask hand washing, Dr. Marty Weiss, who is one of the infectious disease doctors at W Medicine Children, shared a New York Times article. I shared it in the chat. Back in SARS, I know that this is SARS-CoV-2, but they instituted 4 times daily hand washing in some schools, and they actually saw lower absentee rates than prior years because not only were children not getting SARS, they weren't getting diarrheal disease or any of the other typical illnesses that children spread. So, you know, and I think what we learned from the pandemic, a lot of adults had to learn how to wash their hands. So I think it's a good educational opportunity that we're all, you know, teaching children and empowering them of, you know, and I think you could do teaching through it, you know, have them sing their ABCs or their multiplication tables. There's a way to do education in that as well. So I agree with Dr. Moffitt said, and just wanted to highlight also the importance of hand washing and hand hygiene, as that could help not only decrease the spread of COVID, but potentially other illnesses that children frequently spread.
I think the advantage of a mask over the face shield is it keeps your hands out of your mouth and your nose. A face shield is kind of tempting because you can get up there and, you know, and keep your hands. So it takes a little practice to say you need to keep your hands out of your mouth, out of your nose. I know with kids, there's some kids who have their hands in their mouth all the time, and so that's a challenge. But that's the whole thing, is the key is your hands are clean and you're not getting them in your face. So, you know, have a big pump bottle of hand sanitizer. When you all come in, everybody pumps. And then I also shared that New York Times article about SARS. Their point they made was that frequently during the day, the classroom would stop. And this was a woman who was a teacher in China during SARS, and how they kept SARS out of the kids and out of their classroom, but they kept other disease out. And so they made it a routine practice of hand washing. And so I think that, and keeping away from your face, that's the key. And so thank you, Lisa, for bringing that up. It's about the hands and getting away from your face.
So I think we're at the end of the hour. I want to thank Superintendent Burch for a very thoughtful, candid presentation. I really, you know, it is a very, very difficult time with lots of difficult decisions, but it was, you know, I think very reinforcing to hear the amount of thought and consideration that has been taken. So I really want to thank you for all of your great work and for coming today. And I'd like to thank Drs. Costello and Moffitt for all of your contributions. And I'm just going to turn it back to Mitra. Do we have any announcements before we end?
Yes, so we have two quick housekeeping announcements. So our next session will be on August 6th, and Dr. Moffitt is providing our didactics, so keep an eye out for that reminder. If we did not get to your question this time, we'll make sure to ask them next time. And the last thing is that you guys are all awesome. Thank you so much for your time, and we'll see you guys next time. Thank you.
Thank you.
Thank you.